In line with the World Diabetes Day today, we have to talk about health, particularly World Diabetics Day. Of course, you know that epidemic worsens. Of course, from the Guardian newspapers this morning, the World Diabetes Day epidemic worsens as cost of drugs hits 100,000 naira per patient monthly, and many people, keep on suffering from this chronic disease called diabetes, which leads to serious health conditions anyway, but it can be prevented. And talking about it this morning is a doctor right here with us. Okay, I'm talking about Dr. Ejior Ugwu, the National President, Diabetes Association of Nigeria. Good morning and welcome, Doc.
Good morning.
Good morning.
How are you doing this morning?
I'm doing great. And you?
I'm good.
Thank
It
you.
is the World Diabetes Day. So
Yes.
I would want you to start, by telling us everything, the overview of what you know about diabetes.
All right. Thank you very much. I'll just give you a summary because we spent 6 years to study diabetes, diabetology. Yes. If you want to do diabetology, you spend 6 years. All right. So diabetes, in this context, we're talking about diabetes mellitus because there are other forms of diabetes. It's a chronic health condition, and when I say chronic, I mean lifelong, that is associated with elevation of blood glucose to the extent that it becomes harmful to the organs and the systems and leads to potential consequences if it is not properly managed. Now, it's now a global epidemic. Just like you rightly mentioned, it has assumed an epidemic magnitude. And since 2006, the United Nations declared diabetes as a global epidemic and recognized it as a disease that, if not properly checked, is capable of wrecking the world global economy and a very strong militating factor to the attainment of Millennium Development Goals. Now, how does diabetes manifest? There's an organ in the body known as the pancreas, located in the tummy. I'm trying to use layman's. So that organ has different cells, and the cells observe different functions. So there is a particular group of cells in that organ we call the beta islet cells. So those beta islet cells have the responsibility of producing a substance, a hormone, known as insulin. Now, the key role of that insulin is to regulate blood glucose, because after carbohydrate meals, the end products are glucose, as in sugars, okay? So, and after absorption, the sugars get into the bloodstream. Now, when the sugar gets into the bloodstream, it is tantamount to you going to a petrol station to fill your tank with petrol. Do you understand? Now, that petrol, if it remains inside the tank, your car will not move, isn't it? It has to get to the injectors, the carburetors, it has to be burnt, be able to use to produce energy for the car to move. So the same thing, that sugar, that sugar has gotten into your blood from the meal you have eaten. The sugar needs to find their way to the cells and the tissues where they will be metabolized and used to generate ATP. ATP is the energy that drives the body. So, but it is that insulin that's supposed to push this sugar to the cells for this energy generation. So when there is either absolute or relative lack of the insulin, diabetes then results. It simply means that the glucose will be there in the blood in large, high concentration, but it will not be getting to the cells. So that's exactly what diabetes is all about. And we have different types, but three major types: the type 1, type 2, and then the one we call gestational diabetes. The type 1 usually affects children and adolescents, but it can occur at any age. Even a 90-year-old man can have diabetes, can have type 1 diabetes. It's just as commoner among children and adolescents. And this type results from an autoimmune process that destroys those beta islet cells that produce insulin. So they have absolute insulin deficiency, and they require insulin for survival. Without insulin, they die. You can't live without insulin, okay? So, and then we have the type 2, which is the commonest, constituting about 85 to 90% of diabetes cases all over the world. So most of the time when we're talking about diabetes, we're talking mostly about type 2. All right, this type, there's no destruction of the beta islet cells. The beta islet cells are still producing insulin, but is either they are not producing enough due to several, factors, or they are producing enough, sometimes even more than enough, but the insulin they are producing is not doing what it's supposed to do, and that's what we call insulin resistance.
Okay.
So when the insulin gets to where they are supposed to drive the glucose into the cells, they are unable to do that because of some problems, at the receptors. This is what we call insulin resistance. Okay, and this type of diabetes usually affects adults. Before, like when I was in medical school, we used to talk about age 45, 50. All right, but right now I have primary school, secondary school children who are suffering from type 2 diabetes. You understand?
Type 2 diabetes.
Yes.
So
Wow.
In
does
fact,
that
I
mean
have
that
an
it's
11-year-old child. Yes, I have an 11-year-old child who I'm managing now for type 2 diabetes. And in Spain, a 3-year-old child has been diagnosed to have type 2 diabetes. So when we say yes, it's commoner in adults, you understand, it is true. But the age of onset of type 2 diabetes is now becoming progressively lower because of several factors that we're going to discuss probably in the course of this program.
Exactly.
And then we now talk about gestational diabetes, which is the type that affects exclusively pregnant women. All right, and this type of diabetes has a tendency to remit, after childbirth, but it also predisposes that woman to developing permanent type 2 diabetes in future. And if it's not properly managed, it has several dire consequences for both the mother and especially the fetus if it's not properly controlled. So that is diabetes, generally. Now, since we're still doing an overview, let me just touch on the complications of diabetes, if you don't mind.
Go ahead.
Go ahead,
Yes,
please.
good. Now, diabetes is a systemic illness. A systemic illness. And when we say it's a systemic illness, we mean that it affects virtually every organ in the body if it is not properly managed. So, diabetes is one of the commonest causes of stroke. You hear about stroke, right? Yeah. So diabetes is one of the leading causes of stroke. Diabetes is now the third commonest cause of blindness all over the world.
Blindness.
Yes, because one of the complications of diabetes is what we call diabetic retinopathy. It destroys the blood vessels and the cells in the eye and then lead to permanent blindness. All right. So after glaucoma, after cataract glaucoma, diabetes is now the third commonest cause of blindness globally. And then diabetes is a very common cause of heart disease. In fact, the commonest cause of mortality, that's death, among patients living with diabetes is heart disease. Diabetes affects the blood vessels that supply the heart. We call them the coronary vessels, and then lead to coronary artery disease. You must have heard of heart attack. All right. So diabetes also destroys the kidneys. That's what we call diabetic nephropathy. And today, diabetes is the commonest cause of end-stage kidney disease. That is, kidney disease that requires renal replacement therapy for survival, as the patient will either be on permanent hemodialysis or have to undergo kidney transplant for the person to live. Diabetes is now the commonest all over the world. Now, diabetes causes chronic foot ulcers, that is, wounds that fail to heal.
In the stomach.
No, foot on the,
Okay.
the legs.
Okay.
You understand? So most people you see that are carrying wounds on their legs that for months and years, most of them are suffering from diabetes. And if it is not properly managed, it leads to amputation. So diabetes, apart from accidents, trauma, diabetes is now responsible for the cases of amputation, that is cutting off of the legs, all over the world. If you remove trauma, accidents, the next commonest cause is diabetes. So anybody you see whose leg has been cut off, has undergone amputation, just ask the person, did you have an accident? And if the person says no, don't ask any other question. It's diabetes. Do you understand? So, and there are several other complications. Diabetes makes people prone to infections. They can develop infection anywhere: urinary tract infection, chest infection, genital infections, skin infection. Diabetes suppresses immunity and then predisposes people to developing all kinds of opportunistic infections.
What causes diabetes? Because again, it does look like our food contributes to predisposing us to diabetes. What causes it? What is the number one cause of diabetes today?
It's okay. sorry, permit me to modify that question.
Okay.
In non-communicable diseases like diabetes, we don't talk about causes.
Okay.
Yes, when we're talking about communicable diseases like malaria, for instance, malaria is caused by Plasmodium falciparum.
Okay.
Do you understand? So, but it doesn't work that way in non-communicable diseases. So you can't say this causes diabetes or this causes hypertension. We talk about risk factors. What are those factors that predispose an individual to developing that particular sickness?
Okay.
You understand? So in the case of diabetes, we classify those risk factors into non-modifiable and modifiable risk factors. The non-modifiable ones are the ones that we can't do anything about them. They are static factors. They are factors related to nature that we cannot change. One of them is advancing age.
Okay.
All right? The older we are, the more likely that we'll develop diabetes. So advancing age is a risk factor. And of course, it applies to most illnesses because as you age, all the organs in your body also begin to age. So including the pancreas, the organ that produces insulin will also age. So its ability to produce insulin to be able to sustain your metabolic needs will definitely reduce. But you can't do anything about your age. You can't change it. You understand? The same thing with your family history. So diabetes is a familial sickness in the sense that you can inherit the genes from your parents. And once you've been born, you can't change your genes. So once you have a family history of diabetes in your first degree relatives, parents, siblings, children, then you are at risk. It doesn't mean automatically that you're going to develop diabetes. So that's why we don't talk about causes, we talk about risk factors. You understand? And then some ethnic groups are also more predisposed to diabetes. But these ones are non-modifiable. We don't usually spend so much time or throw a lot of emphasis on them because there's nothing we can do about them. It's just for you to know. Now, we dwell mostly on the modifiable risk factors, the one we can change to delay the onset of diabetes or even to completely prevent it. Diabetes is largely a lifestyle disease and is preventable. What are those risk factors? Number one is unhealthy diets. And when we're talking about unhealthy diet, we mean diet that is high in refined sugars, that is low in fiber, that contains a lot of fats. You understand? That's what we mean by unhealthy diet. And this is mostly what you see in fast foods. So people who consume a lot of fast foods, a lot of sugar-sweetened beverages, they are at high risk of developing diabetes. Because if you eat a natural food, let me give you an example. Our local food, apple. You know apple now?
Yeah.
Now, fufu. When you eat it, the carbohydrate in that fufu, in that apple, is complex carbohydrates. You understand? So it's going to take time to digest. To take like 3 to 4 hours for complete digestion to take place. So the sugar that is inherent in that apple is going to be released gradually into the bloodstream. And that will give insulin time to be able to gradually mop up those sugars and take them to the cells where they use to generate energy. The same thing doesn't obtain when you take refined sugar. You understand? Maybe you drink one bottle of soft drink now. The sugar there is not complex sugar. It's been simplified in the course of processing. That's what I'm talking, processed foods. So when you drink it, there's no time for digestion. You have a rapid absorption of sugars into your bloodstream. Do you understand? That overwhelms the insulin, ability of the insulin to, regulate this sugar. So you are going to have high, raised blood glucose.
So eating of apple is healthier than...
Yes. So when we're talking about healthy diet, we mean try as much as possible to eat natural food that are less processed. The more processed a food is, the
higher the chances.
Exactly. The more unhealthy that food is.
At the same time, some people suffering from diabetes, they are being advised to, avoid certain natural foods like water yam and stuff like that.
That's probably one of the
I know you're saying
misconceptions.
we should eat natural food.
Sorry, Belinda. That is one of the misconceptions that I am here to correct.
Okay.
Do you understand? It is not right for a patient suffering from diabetes to avoid any natural food. And anybody who is listening to me now, please, if you're in the habit of giving patients that information, you are misleading them. What happened is that many years ago, about 2-3 decades ago, there used to be what we call diabetic diets. And that diabetic diet that is almost free of carbohydrates, only protein and vegetables, you understand? Even when I was in medical school, I was taught diabetic diet. Because that time it was taught, science is dynamic, knowledge keeps evolving. So that time it was thought that when diabetic patients eat carbohydrate-based food like apple, you understand, there is going to worsen their condition because apple is carbohydrate and it's going to produce sugars and all that. But that has now been jettisoned, all right? Because it's now discovered that there are organs in the body that produce sugar. You see, the brain uses only sugar as a source of fuel. So the body is always doing everything possible to make sure that there's constant supply of sugar to the brain. So when diabetic patients avoid carbohydrate meals and eat only protein and all that, the liver will begin to manufacture glucose to be feeding the brain and other organs in the body. Do you understand? So, and where is the liver going to get the raw materials? From your body. It's going to begin to dissolve, melt, fats. Any glycogen store in the liver will be depleted. Any fat in the body will be melted. And then the liver will now convert it to glucose and feed the brain. And that's why you see those patients losing weight. You understand? We haven't discussed symptoms yet, but weight loss is one of the cardinal symptoms of, poorly controlled diabetes. You get the point? So what we now talk about now is balanced diet. We no longer talk about diabetic diet. A diabetic patient should now eat food that is good for the general population. Just healthy diet. Diet that contains carbohydrate, but it must be good carbohydrates. You understand? Not refined, not processed carbohydrate. Natural carbohydrate, protein, vitamins, fruits, vegetables. Just the same diet that you and I, who are not diabetic, eat. That's what patients who are suffering from diabetes should eat. No longer the so-called diabetic diet. You understand? So we're talking about the risk factors.
Yes.
So I've mentioned unhealthy diets.
Definitely.
Now, the next very important modifiable risk factor is obesity, overweight. I mentioned insulin resistance as one of the pathogenic mechanisms for developing diabetes, especially type 2 diabetes. So obesity is a risk factor for insulin resistance. The fatter you are, the more likely that the insulin your body is producing will not be able to, do its job. You understand? So obesity is one of the drivers of the diabetes epidemic all over the world right now. And then the third thing is sedentary living, sedentary lifestyle, lack of physical activity. Most people are no longer exercising. All right? I woke up this morning and then hopped into my car. I drove to this place. I'm now sitting down. When I'm done, I'll enter my car again, then get to my office. I'll sit down in my office to work. I'll probably work till 4 p.m. or thereabouts. I'll enter my car again, get to my house. I'll probably sit down and start watching TV. You understand? Listen to news or use my computer to do some work. And then tomorrow morning, I'll repeat this same cycle. This applies to most people right now. With this level of urbanization, introduction of technologies, you understand? So a lot of our work now are no longer done manually. Machines, electronics have taken over most of our work and it's making us sedentary. So people have to devise voluntary exercise program. Do you understand? Or inculcate what we call occupational exercise. Right? So sedentary living is one of those things that predispose people to diabetes mellitus. These three are the major ones. All right? That is unhealthy diet, obesity and overweight, and of course sedentary lifestyle, lack of exercise. There are other ones, including excess alcohol intake, cigarette smoking, and so on and so forth.
Let's talk about the misconceptions, because you mentioned a 3-year-old child having type 2.
Yes.
So I wanted to get to know the root cause of, or the factor, the risk factor that caused that particular.
It's all right. Well, a 3-year-old child getting diabetes is unusual. Getting type 2 diabetes is unusual. You understand? So, but it's now a reality. What happens is that if that 3-year-old child has positive family history of diabetes in both parents, you understand? Because if you inherit bad genes from both parents. It's just like hemoglobin gene, SS. Do you understand? So if your mother is AS and your father is AS, and you happen to pick the two S genes from both of them, you become SS. So any child that has family history of diabetes in both parents, that particular child could inherit the gene from both the mother and the father, and then manifest with type 2 diabetes earlier enough. Are you getting the point? Then secondly, our children, when I say our children, I mean even your children, you understand? The kind of lifestyle they are living now, the kind of food they are eating now, very, very unhealthy. All right? So these days, in fact, we do what we call school outreach program now. We call it Catch Them Young. If you go to school right now and inspect lunch boxes of children in various schools, you weep. You understand? You're going to see all kinds of unhealthy choices. You're going to see a lot of, pastries,
Biscuits.
cake, biscuits, soft drinks, carbonated juices. You understand? Commercially prepared fruit juices, and the rest of them. You will hardly see natural, healthy diet in their lunch boxes because everybody wants, fast. Everybody's on the fast lane. You understand? So, what I ate as a child is not what most children are eating right now. When I was in primary school, you wake up in the morning and you eat solid, healthy food.
Like apple.
Yes. You understand? How many children eat those things in the morning now?
Hardly.
So that is why the age of onset of type 2 diabetes is now coming down. Then we also talk about the exercise we mentioned. When I was in primary school, when you come back from school, you just throw away your bag and then you start running from place to place. We lived in a free range system. You understand? I lived in a house where there was no fence, no gates. So the children used to crisscross, all the houses in the neighborhood. What happens to your own children right now? You can imagine. Are you getting the point? Where I live right now, everybody's house is fenced. Okay, so the children live as if they're in prison, and when they come back after eating, they may resort to video games. You understand? Or watching cartoons and the rest of them. Most schools now don't even have playgrounds, especially private schools.
Yeah.
There are no playgrounds. Unlike those days when we were in primary school, we used to play football, volleyball, do all kind of sprinting. You understand? But these days, you go to school, you just see a small, less than half a plot of land is a private school. The children are all in the class with television sets, air condition. Why won't the age of onset of type 2 diabetes come down? So you can see that, in fact, let me tell you, in the world today, 537 million people are estimated to have diabetes. It is projected that by the year 2030, this figure will increase to 643 million. From 537 million to 643 million in the year 2030. We're already close to the year 2030. You understand? In Nigeria, the diabetes epidemic, in fact, the low and middle income countries like Nigeria are projected to have 100% increase in the prevalence of diabetes by the year 2030. The prevalence in Nigeria now is about 5.7%. And this translates to a figure of about 6 to 8 million Nigerians living with diabetes from, studies conducted in Nigeria. Because we don't have a national survey. We don't have a recent national survey. So the International Diabetes Federation is giving us a projected figure. Do you understand? But we know that what they are giving us is lower than what we have. And this figure we are telling you in Nigeria, it may sound high. 6 million Nigerians, 8 million Nigerians are suffering from diabetes mellitus. That is they have diabetes, but they're not aware. Because diabetes is one sickness that can incubate. It can stay in the body for years without the sufferer knowing that he or she has diabetes. That brings me to the misconceptions we talked about.
And then the symptoms too.
The symptoms.
Good, exactly. Good. So now, maybe we'll discuss the symptoms first before we discuss the misconception. Now, the symptoms of diabetes are, I will divide them into classical symptoms and then symptoms of complications. Now, the classical symptoms of diabetes, which develop when the blood glucose becomes so high, include excessive drinking of water, what we call polydipsia. The person becomes unduly thirsty. The person feels like consuming gallons of water, you understand, compared to the previous habits. Then, compared to the usual habits. And then, of course, excessive urination. Yeah, the individual begins to pass large volumes of urine and also much more frequently. So, and then the person begins to lose weight, unexplained weight loss. This person is eating and yet is losing weight. And of course, increased appetite, voracious appetite. The person feel like eating 4 or 5 times in a day. All right, that's what we call polyphagia. So in medicine, we talk about polyuria, which is excessive urination, polydipsia, which is excessive thirst, polyphagia, excessive hunger or appetite, and then unexplained weight loss. Why we use the word unexplained is that naturally anybody who is not eating will be losing weight. So that one is explained. But this person is eating more, but is losing weight. So how do you explain that? You understand? So these are the 4 cardinal symptoms of diabetes. But let me sound a note of caution here before we discuss the misconceptions. You find these cardinal symptoms in less than 30% of patients who develop diabetes. Because, like I mentioned, these symptoms develop only when the level of blood glucose becomes so high that it begins to spill into urine. You understand? What we call glycosuria. That is presence of glucose in urine. That's what we call glycosuria. And this happens when the level of blood glucose is more than 180 milligrams per deciliter, which is what we call the renal threshold. The renal threshold is the level of blood glucose at which the kidney can no longer reabsorb it back to the blood and it begins to spill into the urine. And it is 180 milligrams for most people. So when the blood glucose is 160, it may not appear in urine. When it's 140, you may not see it in urine. Yet the individual is diabetic. Do you understand? So that person may not urinate excessively. The person may not have any test. The person, you understand? The person is just going about his normal business, but he's diabetic. So asymptomatic presentation, that is diabetes without symptoms, is very, very common in up to 50 to 75% of individuals who have type 2 diabetes have asymptomatic presentation. They don't have those classical symptoms. All right? So, and those individuals will just progress to complications. So that brings me to the symptoms of complication. The individual might just come down with stroke. You understand? One hand may just get paralyzed, or the leg, or the mouth shifted to one side, and all those symptoms of stroke. And it's only when that person gets to the hospital because of the stroke he has suffered that we discover that the individual has diabetes that was not diagnosed. Some other people, very common, notice blurry vision. You just notice that your eyesight is deteriorating. You understand? So you begin to wonder, and it'll be getting worse. It takes them to eye clinic. So when they get to the eye clinic, the first thing they do is to check their blood sugar. And that is where a lot of diabetic patients are picked up. The individual has been diabetic for years. The sugar has been accumulating in the eyes, causing, premature cataracts, retinopathy, and all that, but the person is not aware. You understand? Then some other people come with recurrent genital infections, especially women. They keep complaining of, vaginal discharge, itching, and, stuff like that. So many of them keep going to the chemist to buy drugs, antibiotics. After taking it, they may have a temporary relief, and then within a few months, develop another one. So, and it's because their urine, like I said, contains sugar. You understand? So, the presence of sugar in that area will encourage proliferation of microorganisms. So they keep having infections, and Then some other people will have wounds. It might start with minor wound on the leg, maybe just during pedicure, or the person just sustained a minor cut in the farm or something. That hit out in the past used to heal, within a very short period of time. The person will notice that this wound is progressing. You understand? In spite of, local treatment from chemists and all that, the wound keep progressing. Some of them develop what we call cellulitis. Before you know it, the leg is swollen. Okay? So, and when they now come to the hospital, we discover that they have diabetes. And that is why the wound is not healing. That's why, so they come with diabetic foot ulcers. So, and some other people, like I say, symptoms of kidney disease that they come with. So these are symptoms of complications. Now, what are the misconceptions now? The misconceptions are: number one, some people feel that because diabetes has to do with sugar, and sugar is sweet, that anything bitter is an antidote to diabetes.
Actually,
I mean, that is understandable.
Understandable from a layman's point of view.
yeah.
So we've had patients who consume gallons of bitter leaf. You understand?
A bitter foods.
You know? So, and all sorts of, in fact, even small stouts. Yes. One patient drank stout, small stout is bitter.
Yeah, it's bitter.
You understand? So they think it will dilute the
Sugar level.
and then bring it down. It's a very, very,
Wrong
prevalent,
misconception.
yes, a misconception. It's a wrong notion. And I think the general public needs to know about it. Yes, taking vegetables, including bitter leaf, is good for everybody, whether you have diabetes or not. You understand? But it's not an antidote to diabetes. Another misconception is this belief that unless you see ants crawling around your urine, that you don't have diabetes. I have had patients who say, but anytime I urinate, I don't see any ants around my urine. You understand? So, if you drop sugar here, if you come back here in the evening, you are going to see ants around it. So the same thing when patients who have diabetes urinate and it contains sugar, there's tendency for ants to, gather around that urine. You understand? So, but just like I explained to you, somebody who had diabetes may urinate without sugar inside that urine when the renal threshold of glucose has not been exceeded. You understand? So that is another wrong notion. Okay, you don't need to wait for ants to gather around your urine before you know you have diabetes. All right. The same thing, similar thing is some people tasting their urine. Some people taste their urine to know whether it tastes sweet. Do you understand? That is also wrong. Okay. Of course, when your renal thresholds have been exceeded and there's glucose spilling into your urine, the urine is likely going to taste sweet. Okay. But it doesn't mean that when your urine is not tasting sweet, that you don't have diabetes. Now, another misconception is the belief that if I am not urinating excessively and I'm not losing weight and all that, I don't have diabetes. No. All right. So that's why I told you about asymptomatic presentation. Each time we go for screening, because Dan, as an NGO, one of the things that we do is, screening of patients. Like now we're celebrating World Diabetes Day. We have a lot of screening activities going on all over the country. Each time we screen a population, anywhere, there are always people who will be shocked that we diagnose them to have diabetes right there at the screening venue because they have no symptoms.
Wow.
They have no nothing. You understand? Only for us to check and discover that their blood glucose is 210, 180, 160. You understand? So you don't have to wait for symptoms. And that's why we recommend that every adult should undergo diabetes screening, whether you have symptoms or you don't have symptoms. And if you screen and it is negative, you don't have diabetes, you should repeat it annually, just once in a year. Do you understand? So these are some of the misconceptions. Other misconceptions are when people develop diabetic foot, they think it's poison. Because the speed with which the wound will progress. So they say, no, this one is not ordinary. You understand? After all, 5-6 years ago, I sustained wound on my foot and it healed within. This one is something extraordinary. So many of them think that they stepped on poison, and instead of coming to the hospital, a good number of them go to alternative medicine outlets. And as they are doing all those things, the wound is progressing, only for them to come to the hospital when the wound has advanced, and then the risk of amputation or death is very high.
Well, when you are diagnosed of diabetes, what do you do? And there's those symptoms, nothing at all that shows that you are diabetic.
Yes.
What then do you do at that moment as somebody who has been just diagnosed?
Once you are diagnosed to have diabetes, you go to the hospital to see a doctor who is knowledgeable in the management of diabetes. That doctor will decide exactly how, because everybody is not on the same management plan.
Okay.
Managing diabetes now is highly individualized.
Okay.
Yes.
Do you understand? So it's not like a one size fits all.
Okay.
Okay, so the doctor will now determine whether you should just be on lifestyle treatment alone. There are some patients that, depending on the level, of glucose, and if they are free of complications and they are motivated, we put them only on lifestyle. You understand? Encourage, if they have been guilty of unhealthy diet, we'll stop it. They change their diet, they become more physically active, then they will continue monitoring, and some of them do well.
Cool.
I have patients who are only on lifestyle, they are not on medications, and they are doing well.
Okay.
Then there are some other ones, depending on there's what we use to determine the level of diabetes. We call that test glycated hemoglobin. Okay. So when we check it and it's high, meaning that the risk of complications is also high, we commence the individual on medications. And then the medications to use depends on the individual. It's not what you give Mr. A that you give to Mr. B. It depends on several factors: the age, the weight, you understand, the organ function, like the kidney function, the liver function, and the rest of them. All right. Then that person will also need to see a dietitian who will work out dietary plan, with that person, depending on whether we want that person to lose weight or we want the person to gain. Because some of them have lost so much weight that they actually need to be on some weight building dietary regimen. Yeah. Okay. Yeah. Then we also screen the person for complications, because somebody may have diabetic eye disease but has no blurring of vision. The person is still seeing clearly, but diabetes has entered the eye. It's just that it hasn't gotten to a point where the vision begins to deteriorate. So we send them to ophthalmologists to do what we call dilated fundoscopy. To look at their eyes. Then we screen them for presence of kidney. There are tests we use to detect early, kidney disease. Because once we discover all those things, we can reverse, some of those things.
Wow.
So it means that diabetes is curable?
Diabetes is not curable. Diabetes is manageable. I'm talking about, when I use the word reverse, I'm talking about complications. If somebody has got signs of early kidney damage, do you understand? We can put the person on regimen, on treatment. The person will still be diabetic, yeah? We can put the person on regimen that will protect the kidney. Do you understand? Reverse the development of that kidney complication, or stop it where it is, or prevent, further progression.
Wow.
So, because this thing you said now is another misconception. Do you understand? That diabetes is curable. There is a type of diabetes that is curable, but we don't like discussing it because people will pick only that part and then leave the rest, because that one constitutes less than 1% of diabetic cases all over the world. And that's the one we call specific type of diabetes. I told you that I talked about 3 major ones. I told there are other ones.
Just in 1 minute, because we're out of time. Just finish off. Just 1 minute, yeah.
So that specific type of diabetes is diabetes arising secondary to another, disease or illness in the body. You understand? Now, if somebody has got goiter, this thing that grows on the neck and all that, and the person develops a sickness we call thyrotoxicosis from that goiter, it can lead to diabetes.
Wow.
As a complication. But the moment you treat the goiter, you understand, that diabetes is reversible. Then some people are abusing drugs, steroids. Some of these people that, once they have pain, they say they have arthritis, they go to chemists and they mix all kinds of drugs, including steroids like prednisolone, dexamethasone, and all that. Those drugs are diabetogenic. So the individual can develop diabetes by abusing those drugs. But when we discover it, that's why when the patient comes, we take history. We try to find out what are the risk factors that predispose this individual to developing diabetes. If we discover that is the problem, and we stop those drugs, over time, that diabetes can undergo permanent remission. So those are the kind of diabetes that is curable, you understand? But this constitutes only less than 1% of diabetes. So that's why we say that diabetes is not curable.
Wow.
You getting the point?
Doc, I mean, this is an eye-opener, fantastic discussion, frankly speaking, and something that a whole lot of persons have been looking out for when it comes to health as it relates to diabetes. Many thanks again for your time and your insights into the show. Hopefully, maybe sometime later, we'll invite you for more insight, on topics like this.
Thank you very much. I wish you had a little more time, because diabetic patients are going through a lot in this country, and I wanted to use the opportunity to bring it to the fore, to the knowledge of government at all levels, about what our patients are experiencing so that they can come to their aid as we mark the World Diabetes Day. And since we're discussing barriers, barriers to care and all that, in this country there are several barriers. I don't know if you can just spare me, just a minute or two, to discuss that.
Okay, just a minute. Just rolling through.
All right, thank you very much. Well, let me not even discuss much. The cost of managing diabetes in Nigeria has become exponentially unaffordable.
Wow.
An average person in Nigeria now spends close to 100,000 naira per month to manage diabetes. What is the minimum wage in this country? How many patients can afford it? And let me just give you one example. There is a drug, a medication we call insulin, that is which is a lifesaver for type 1 diabetes. And most patients with type 2 diabetes are also on that drug. It used to cost 4,000 naira. It is now 18 to 22,000 in most pharmaceutical stores. Yes. And so many patients have resorted to alternative medicine. So I'm talking to you. And we are now having a lot of diabetes-related complications in the country. A lot of deaths are going on right now. I told you that we used to have like 30 to 40,000 deaths from diabetes alone annually in this country. It has increased, And I want to use the opportunity to beg the government to please do something. They can subsidize diabetes medications. You understand? It is done in many countries. In fact, if you go to Egypt, insulin is free for anybody diagnosed diabetic. You understand? So in this country, we're not poor. Nigeria is not poor. Let them subsidize these drugs so that these patients will not be dying like chickens. Wow. All right. Then we also advocate that they should remove taxes on importation of diabetes drugs and consumables, so that the landing costs will increase. And there's a need to strengthen the primary healthcare centers to be able to manage uncomplicated diabetes, employ people, train and retrain, you understand, and then provide facilities, equipment for diabetes care, because the diabetes specialists in this country are very few. Endocrinologists like me, we are less than 200 in the whole country to manage a population of 6 to 8 million Nigerians living with diabetes, and more people are getting diagnosed. So and that's why you find endocrinologists only in urban centers. Go to rural areas, go to semi-urban areas, they are non-existent. So those areas are underserved, and that is where the complications and deaths are occurring on a daily basis.
Wow.
You understand? And the federal government also needs to we don't have a national diabetes registry. Every other country has it. We don't have one in this country. And there's no national diabetes policy in Nigeria. You understand? So all the stakeholders, Federal Ministry of Health, the diabetes associations and other stakeholders need to come together to formulate a national policy and strategic plan for diabetes, so that people will not be dying like mosquitoes. So these are some of the challenges that I felt the government needs to know. I mean, it should fall on the right ears so that something can be done to save the lives of these millions of people.
All right. Thank you so much,
Thank
Doctor.
you very much. Thank you.
Dr. Ejior Ugwu is the National President, Diabetes Association of Nigeria. Many thanks for your insight.
Thank
Truly
you for
appreciate
your time.
It's my pleasure, Charles and Belinda. Thank you for inviting me.
All right, we're connecting back to our Abuja studio for more on the discussion. Stay with us. This is Signature Television. My name is Charles Pius.
And I am Belinda Nwobodo.